has when they finish their education is how do they go about taking the next step and how do we move forward? I think choosing the right path itself is the initial challenge. Before we delve into the business of ophthalmology about choosing whether you're going to an institution or a private practice, I think the first question which every young doctor must ask themselves is, are we adequately trained? Do we have, and at this day, in this day and time, in our generation at least, I think a fellowship training is almost invaluable. Some form of specialty training is extremely necessary to differentiate ourselves from our neighbors. Next comes, where do I settle down? Do I settle down in a big city or a small town? I think a number of our friends are living examples of this, wherein, moving from immediate post-fellowship, they start thinking, I'm from Bombay or Delhi. Now, when I go back to Bombay or Delhi, how do I actually set up my own practice when there is a skilled and trained ophthalmologist in every other street corner? I think it is in both their personal interest as well as the interest of the country as a whole for them to start looking at locations away from the metro cities, moving into smaller towns where still the opportunity exists. And when I say opportunity, it doesn't mean you have to dream small. Some of the greatest institutions of our time, be it Madurai, Chitrakoot, Barakpur, have all come from the smallest towns or the smaller towns of our country and have grown into one of the largest success stories in the world. The next is also important for us to now recognize that as a young ophthalmologist, that ophthalmology is not equivalent to cataract surgery. Yes, cataract surgery is an integral part of and probably will be your bread and butter. But for us to differentiate ourselves and to move forward and as a beginner to strive in this world, even be it in a smaller town or a bigger city, we have to differentiate ourselves. We have to create our own identity amidst the numerous options which are available in whichever town or city you're practicing in. And this can be done by probably your specialty experience in giving rise to surgeries which are low cost, be it a keratoprosthesis or a DMEC. The investment in actually doing these surgeries is almost next to nothing. It is only the skill that you have acquired in your training which helps you do these particular surgeries. And truly, it is not these surgeries which is actually going to bring in your revenue. You could probably even do these treatments free of cost for patients who really can't afford it. But some of these surgeries are the ones which are probably going to bring you back many more patients through word of mouth, where patients who've had no other options and have been turned away in many smaller centers, and they come to you and you give them that quality of care, will definitely bring in more patients to you. It's not just about learning and knowing these surgeries and sitting in one place, but as a beginner, going out, meeting several other doctors personally, and creating a referral bastion for yourself, wherein those doctors who may be routinely doing cataract surgeries by themselves, but would dearly love to have a corneal or a retinal surgeon who can take care of the issues which they see in their own day-to-day practice. And just not stops with doctors. Holding small group meetings, it could be as simple as a Lions Club, Rotary Club, but going there and expressing what you have come to this town to deliver is exceedingly important for any junior surgeon. Reaching out to the community cannot be overemphasized, and it is important for every aspiring young surgeon to know that community service is not just restricted to large NGOs or large institutions, but it just requires a dedicated 3 to 4 member team who can actually go out in the field, create awareness, help out the people, conduct screening camps, you could conduct low-cost free surgeries yourself. And it is through this awareness in the community which will actually help your own practice grow. And I think over the years, Arvind Eye Hospital time and again has shown that example of actually going out into the community, which really helps them grow in each individual place. But most important for any beginning surgeon is to getting their own team right. From the front desk staff to optometrists to counselors to patient care coordinators, public relation, people would think, a beginning surgeon would think that probably having all these bifurcations, such a structure in his organization is probably not as important. But I think that's the most important in today's world. A very large institutions which have 10 to 20,000 employees under them can afford a large degree of attrition. But then a small beginning surgeon who's setting up a practice really needs a core team in place. And having this core team, attrition could be the death knell for such a private practitioner. It's important that we train that core team well, pay them well, keep them happy, and keep them motivated so that they maintain the ethos and pathos which you want to instill within them, within your own institute, and move forward with yourself. I truly believe there is no replacement for skilled personnel at various fronts. A skilled optometrist can take up the role of both an optometrist who's doing a simple vision refraction, doing a slit lamp examination, and also acting as a counselor. It is important to remember when the patient is still in an optometrist's room or in the doctor's room, they still continue to be a patient. But once you just tell the patient, go to the counselor, and there they sit down with a chart and all the packages and the prices, they stop being a patient but become more of a customer. And it is very difficult at that time to actually be talking the benefits of, let's say, technology, technique vis-a-vis the price. The patient is certainly more receptive within the own confines of an optometrist's cabin or a doctor's room. And again, effective counseling and communication by use of video aids, really enhancing patient experience at every front, making sure, especially in early practice, for them to feel that they should choose you over multiple other options which are available in your town. Continuous feedback collection from these patients. Every third, fourth patient in a small patient, this can be given a small printout right at the very beginning and asked to fill up before they leave the hospital and give it to the receptionist when they're leaving the hospital. This acts as a great tool in really knowing, in looking inwardly at ourselves to see where we can improve ourselves, how we can improve patient experience. Handling dissatisfied patients is exceedingly important. Spending enough chair time, probably much more chair time with a dissatisfied patient really goes a long way. If you handle a complication well, this patient becomes a patient for you for life, even, and would probably end up referring many more patients than a patient who really had a good outcome. And as Shail alluded to earlier, it's exceedingly important that we maintain this balance of price versus value. And it's really important that we don't get sucked into, especially in an early practice, even in a small to mid-sized town, of that kind of technology or kind of fanfare which comes along with these various multinational companies. It's important that we balance what we are going to provide to the patient with what we have in our hands. We have various multitude of Indian options, both in equipment, lenses, everything, which offer world-class quality at a much more affordable price. And this can easily be transmitted to our patients. Now is the day of any digital era. Even in a small town, if right from an auto driver to the executive in a building has access to a smartphone, everyone has access to 3G. And digital marketing is probably one of the easiest and the best ways to reach out to the masses. Right from the very beginning, for any small hospital, it's important they adapt to these small changes in technology, have an appropriate EMR, appropriate documentation right from the very beginning, so that they can have these multiple visits of patient care, which really enhances the quality of care delivery to our patients. And I think at the end of the day, it's really important that we keep looking at ourselves to keep improving upon what we are doing. I think our biggest competition and comparison is our own individual self, and that is how I think as each individual young practitioner, we can grow in our practice. Thank you for